Hi, this is Brandon with ChiroUp. I want to tell you about a recent paper by Brahma and American Journal of Sports Medicine. Great paper documenting one simple thing we can look for with patients having lower extremity injuries due to running. And they took a look at 72 people having a range of lower extremity issues, whether it's Achilles tendinopathy or patellofemoral pain syndrome, medial tibial stress syndrome, and also IT band syndrome. And what they found are three characteristics that these runners demonstrated while they were running that led to their issues. The first being a forward trunk lean. When they got tired, they started to lean forward a little bit more. The second being landing with an extended knee and an extended and dorsiflexed ankle. And the last, most important part, was that these people had an increase in contralateral pelvic drop, showing hip abductor weakness. These patients all could still run, but were demonstrating running pain after about 10 minutes, showing this is a muscular weakness type injury. So hip abductor weakness could be something that you should be looking for in your running population if they start to demonstrate pain during their runs. So how do we assess for that? The first being the lag sign. As you can see here, we're having our patient on their side. They're going to bring their leg into 20 degrees of abduction, 10 degrees of extension, and then internally rotate. If you see that leg drops down into external rotation, then they have some signs and symptoms of some tendinopathy within those hip external rotators. The next being the Trendelenburg test. I just call this a single leg stance because really you're looking for a compensated or uncompensated Trendelenburg from what you can see here, but you're looking for that opposite hip to drop, you're looking for that knee to drop in a valgus or instability. Running is a one-legged sport, so if they can support themselves on one leg without having good balance or good support, there's bound to be something that's going to happen to them in a negative way. The last being the single leg squat. I love this test. I do this on every single one of my patients regardless of what condition they're having. But you're having the patient squat down, you're looking for that knee to drop into valgus presentation, the foot to drop into hyperpronation and any kind of imbalance. I hope this helps. These are three tests that I use in my practice on a daily basis, assessing for hip abductor weakness. I've included a PDF at the bottom part of this blog, and that has what exercises I give to my patients who are having some hip abductor weakness while they're running. And remember, this isn't going to fix itself in one day. It's not going to fix itself in 1 week. It takes a little time to build some strength. So tapering these people off their running regimen, getting them to start to build the muscular strength takes a long time. But it's up to us to educate them on why it's so important to prevent injuries in the future. Thanks. Hope this helps. Thanks for subscribing to ChiroUp blog, and I hope to see you in the future, whether it's at a seminar or the next blog coming up.